Hello, everybody. Thank you so much for joining us. I see some people logging on. I'm going to go live on Facebook, so that's just going to take a minute. I hope everybody had a good first day of spring. It was nice and warm here in Delaware, so I hope you had a good day too. We're almost there. Okay, and I think we're good to get started. So welcome everyone. I'm so glad you're here. My name is Carly Mertz, and I have the pleasure of hosting this evening's Integrative Nurse Coach Gathering webinar. Tonight, we're diving into a fascinating topic, nursing pathways in psychedelic care. And we're honored to be joined by two incredible nurse leaders, Diana Zamora and Kayla Kinsman, who will be sharing their journeys, experiences, and wisdom in this important and evolving space. So before we begin, I'd like to share a little bit more about our inspiring speakers. Diana Zamora is a multi-passionate health professional with degrees in nursing, respiratory therapy, and environmental science. With over a decade of experience in ICUs and long-term acute care, she also served on the Patient Ethics Board in Houston, Texas. For the past 8 years, Diana has worked with rural tribal communities in California, leading statewide education campaigns and developing community health worker and medical assistant training programs. As a board-certified integrative nurse coach and graduate of the California Institute of Integral Studies in Psychedelic-Assisted Therapies and Research, Diana is deeply committed to health equity and supporting healthcare staff in tribal organizations through coaching, strategy, and education. And Kayla Kinsman is a psychiatric mental health nurse practitioner who specializes in psychiatric evaluations, medication management, and ketamine-assisted psychotherapy. With a background in psychology and nursing, Kayla earned her master's degree from University of California, San Francisco, and her Doctor of Nursing practice from Oregon Health and Science University, where her research focused on psychedelic-assisted therapies for veterans with PTSD. She brings a holistic and heart-centered approach to care, combining traditional psychiatry, functional medicine, herbalism, and psychotherapeutic modalities. Kayla has spent nearly a decade serving veterans with PTSD, substance use disorder, and homelessness, and continues to be a passionate leader and advocate for healing in all forms. So before we dive in, I invite you to kind of settle in your space, gently release any tension you may be holding, and let's take a few slow, intentional breaths together. You can inhale deeply and exhale fully. We can do another one. Inhale deeply and exhale. Feel yourself arriving in this moment, surrounded by a community of like-minded nurses dedicated to growth, healing, and expansion. Let's open our hearts and minds to the new wisdom that's about to unfold in our time together. And a quick reminder, please place your questions in the Q&A box at the bottom of your screen, and we're going to leave time at the end of the discussion to go over those. And now I am so excited to welcome Diana and Kayla to the webinar.
Hi, everyone. Let me take a moment to share my screen.
Thank you.
Thank you for your kind introductions. Again, my name is Diana Zamora, and with my co-host, Kayla Kinsman.
Hi, everyone. Yes, thank you for the introduction. That was lovely.
This is us, and this is the course that we have co-created in Nursing Pathways in Psychedelic Care. So Just a moment. Okay. So it's always good to revisit foundations of nursing as we pursue information on psychedelics. Caring science is a nursing theory that was developed by Dr. Gene Watson, and who earned a reputation as being one of the leading nurse theorists and professors of the modern era. The concept of caring science in nursing was first published in 1979, but Dr. Watson considers the theory to be an evolving philosophical approach that can be adapted to meet the changing needs of the current healthcare landscape. The core principles of caring science in nursing includes human dignity, authentic presence, creating a healing environment, and it's rooted in the traditional discipline of nursing, yet heavily influenced by other modalities. In today's complex healthcare landscape, caring science in nursing is becoming more important with each passing day. Nurses are not only charged with providing clinical care to their patients, but they also serve as the first line of support to them and to their families. Caring science in nursing allows nurses to better advocate for their patients and to ensure that all the needs of their patients are met as they receive medical treatment that they need. And that includes the use of psychedelic medicine. As research into psychedelic therapy expands, the intersection of caring science and psychedelic medicine is becoming more evident. The care science model defines in many ways the core of our discipline: health, care, person, and environment. Health refers to the harmony between mind, body, and soul. Caring is an art and science, a moral ideal and transpersonal process which aims to promote body, soul, and spirit. Person is a living form that grows and is composed of a body, a soul, a spirit, and finally, environment is the internal and external reality of the person. The nurse in caring relationships is seen as a co-participant in this process. And this aligns a lot with the process of psychedelic care. I think when Jean Watson developed the theory of human caring, she likely never envisioned its principles being applied to the current resurgence of psychedelic research and assisted therapy. But here we are. The elements I just reviewed are perfectly aligned with those skills that make a good psychedelic facilitator. Let's take a step back and look at the history of psychedelics being used in therapeutic settings prior to becoming illegal in 1970. We look at use by indigenous peoples. We see in 1943, Hoffman discovers the properties of LSD. The first uses of LSD to treat psychiatric illnesses in 1953. And then you see Hoffman synthesizing psilocybin in 1958. You have in 1970, the Controlled Substance Act. But when you look, you look at the timeline between 1950 and 1970, there was about 1,000 studies on addiction, end of life, and anxiety and behavior research studies done on approximately about 40,000 participants. And if you look at this particular timeline that comes out of the University of Pennsylvania, it's one of the few timelines that you'll see pictures of nurses actually in these studies. And you see them taking vitals, actually distributing the medication. And this is kind of where I would like to start a discussion of nurses in psychedelic research.
All right. In the golden era of psychedelic studies, there's preserved clinical and research literature from the mid-1950s to early 1970s. However, in this research, there are very few traces of the nursing legacy or presence that have been documented. In one article written by a nurse by the name of Laura Berg in 1994, she indicates that throughout the late 1960s and the early 1970s, journals of nursing published sporadic articles on the drug culture and the effects of hallucinogenic drugs. Reflecting the sociocultural tone of the times, these articles were almost exclusively authored by male physicians and pharmacists. And she continued her search trying to find documents where nursing was represented, and her research led her to find only 2 RNs that wrote first-person accounts of their clinical experiences working in the late 1960s. One by the name of Margaret Sandcott in 1968, who was the head nurse of the Haight-Ashbury Clinic, and then Catherine Dansky in 1970, who was a nurse who worked in the Medi-Rock Project, which was a 1960s rock festival. While clinical and scientific articles, related to psychedelic nursing is relatively unheard of throughout the 1960s, writing by nurses about their experiences during the thousands of hours of intensive psychedelic research is also, unfortunately, virtually non-existent. There are references kind of scattered and fragmented and most often discussed in conference reports rather than published papers. There's also minimal passages in magazine articles that indicated that nurses had significant roles as sitters, guides, facilitators, or even just presences in a wide range of the psychedelic studies at that time. Next slide, please. All right, so this is a photo taken at the Spring Grove Hospital of the Maryland Psychiatric Research Center. And this center is where much of the research on psychedelics were developed. So there are first-person accounts that also indicate this center provided compassionate and fully sanctioned research on therapeutic uses of psychedelics until the early 1970s. Although studies at the Spring Grove State Hospital and those that followed at the Maryland Psychiatric Research Center ended in 1976, they do remain the largest, most sustained and systematic studies of psychedelic drugs and psychotherapies yet attempted. And nurses were present providing care on a daily basis. Next slide, please. And as you can see from these photos, nurses were in fact providing care. But unfortunately, the scientific articles didn't really give them the credit that they were due and all the work that they performed. They were described by the research physicians as not having enough training to interpret the patient's material. One article further describes nurses being instructed by lead physicians to approach the patients in a motherly, consoling, and reassuring way during the psychedelic treatment. Another research article in 1969, there's a statement that reads, if the physician does not have the patience or inclination to be with the patient during the 5 or 6 hours of psychedelic treatment, then he should get a nice, gentle, kind, and preferably good-looking nurse to remain with them. An actual quote from the article. So the bedside care and one-to-one dependability for experimental psychedelic subjects was mostly delegated to nursing staff. MDs described the work of sitting with patients as time-consuming and tiring, also exhausting and too time-constraining. And then there are further references that indicate that physicians were not continuously present during psychedelic sessions or experiments, but nurses usually were. As a present day nurse, and looking back at these studies, much of the value of kindness, gentleness, and presence that was provided by many of the nurses was never really taken into consideration and might have been a more important part of the psychedelic sessions and the positive outcomes suggested by male researchers. Next slide, please. So flash forward to now, 2025. I think it's pretty imperative that nurses start finding opportunities to insert themselves into the current studies and develop a seat at this table. At the core of the current research being performed across the globe, there's a central theme of building trust and safety with the client and within a therapeutic set and setting. As we are aware, nurses are experts in creating trusting physical and emotional environments that support total healing and overall wellness.
Let's take a look at the history of the use of set and setting. It is a universal term among psychedelic communities. Set and setting describes the interplay between substances, internal state of the individual, and the external environment. According to history, the concept of set and setting was first introduced by Timothy Leary and his colleagues at Harvard, and it was also laid out in their 1964 psychedelic guidebook called The Psychedelic Experience, a manual based on the Tibetan Book of the Dead. Set and setting, respectively, refer to the internal and external factors that influence your psychedelic experience. Set refers to your inner climate, your mood, your personality, your beliefs, your perceptions, and so on. Setting refers to all that's going on outside, such as people around you, their behaviors, the music that's playing, the smells, the weather in the air, even the cultural forces that aren't as readily visible. In the occult classic book called The Psychedelic Experience, Leary, together with his colleagues Ralph Metzner and Richard Albert, reflected the following. Of course, the drug dose does not produce the transcendent experience. It merely acts as a chemical key. It opens the mind, it frees the nervous system of its ordinary patterns and structures. The nature of the experience depends almost entirely on set and setting. Set and setting are not unique to the psychedelic experiences. One study, for example, described how set and setting affected an individual's sense of religious mystique when experiencing nature in isolation. Obviously, our internal state and external environment are the lenses through which we experience and process reality in any situation. But the reason set and setting are so frequently discussed with psychedelics is because these substances have a way of intensely amplifying those lenses. Alongside this revival in the use of psychedelics in clinical settings, there has been an increase in the prevalence of recreational use, with many using psychedelics to deal with difficult emotions or to improve their well-being. While clinical research is conducted in carefully controlled settings, this is not necessarily the case for recreational use. As the psychedelic movement expands, with mounting research serving to change the tide of public opinion, more people are seeking out psychedelics as modalities for healing and self-exploration. Whether in the context of psychedelic therapy, assisted therapy, or plant medicine ceremonies or recreational use, the modern Western psychedelic model has long been interwoven with this concept of set and setting. But however, there's been little development of which variables fall under this umbrella of set and setting since its conception in the 1960s. In an article co-written by Kwasi Adusi, a psychiatric nurse practitioner, he indicates that considering the growing mainstream emergence of psychedelics, set and setting alone is no longer sufficient as a harm reduction mantra, nor is it sufficient as a guidepost for psychedelic therapy and research. He argues that as a matter of public health, this mantra must evolve into set, setting, and support. As psychedelic researcher and transpersonal psychologist Stanislav Grof said, Psychedelics can be a non-specific amplifiers of mental or psychic processes. That is, they have this ability to amplify content which is concealed in the psyche, bringing up thoughts, emotions, and sensations that were previously we were unconscious of. Thus, it's important when looking for someone to support the journey when taking psychedelics. It's to find a non-judgmental, trustworthy person to share this experience with. For some individuals, this person might materialize in the form of a therapist, a counselor, a coach, a shamanic guide, and for others, it might be just a trusted friend or a family member. Nurses, as healthcare providers, we need to be prepared in a variety of healthcare modalities to provide care for individuals that choose to use psychedelics.
So there's been a long history in the fields of psychology and psychiatry of using non-ordinary states of consciousness. Sometimes that's also referred to as altered or expanded states to facilitate deep psychological work. There have been several studies that have recently suggested the therapeutic value of psychedelic experiences may lie in their ability to increase or facilitate mental flexibility, insight, and acceptance. In a recent webinar that was presented by the Korea Institute in 2024, they shared the following information when discussing the role of different providers in short and long-term care of patients in ketamine treatment. I thought it was interesting how this doctor made the distinction of each healthcare provider. And my personal thought when I saw this slide was, yes, a nurse does provide psychospiritual support. And that embodies so many things. So when you refer to your nurse coaching or nurse holistic books, you would find nursing models that discuss the nurse or that nurses play a vital role in providing psychospiritual support. That includes elements such as encompassing emotional, social, and spiritual well-being through active listening, therapeutic presence, and facilitating the expression of beliefs and practices. Nurses are uniquely positioned to provide psychospiritual support because they're often the primary point of contact for patients and their families, and that allows them to build trust and rapport. They offer a therapeutic presence, being fully present with the patient, especially during difficult times. Next slide, please. And the scope of nursing practice provides a pretty natural context for spiritual interventions to be delivered to support patients in confronting existential types of questions related to the meaning of life, pain, agony, and even death. So it's quite a broad range there. The American Holistic Nurses Association describes the holistic nursing practices as focusing on whole person care that naturally embraces the spiritual dimensions. Also in 2012, the American Nurses Association recognized that nurses provide spiritual interventions focused on presence, guidance, nurturing, or encouraging an individual or group's ability to achieve personal, spiritual, and social well-being and integrate body, mind, and spirit. Defining the human spiritual dimensions is no easy task, especially those that arise from psychedelic experiences. There are three components that can be discussed, such as the need for meaning or purpose in life, the need for hope, and the need for belief or faith in self and others, and a power beyond the self. Psychedelics are an important category in the landscape of holistic health because they offer unique properties for deep healing, which go to the core of people's problems rather than just treating or masking the symptoms, so to speak. Next slide, please. You got it. In more recent years, Western scientific studies have consistently affirmed the healing potentials of psychedelics, promoting a growing number of individuals to explore their use. And simultaneously, there's a notable increase in individuals wanting to facilitate psychedelic care. So psychedelic medicines can blur the boundaries between the self and others, And this really highlights the importance of a supportive, responsible, and present facilitator or guide. There are many articles you can find that are written on core competencies that are needed to be a facilitator. In recent years, there have been attempts to outline the core competencies and responsibilities for professionals facilitating transformative journeys. Um, Dr. Anya Losaiga-Velder draws a powerful analogy likening the role of the psychedelic practitioner to that of a midwife of the soul, which I thought was pretty profound. So that sort of describes someone who is able to create a safe container for the natural unfolding of the non-ordinary state while remaining attuned enough to discern when a more active support role is necessary. She also articulates, I believe a psychedelic practitioner is someone with the capacity for selfless service, someone who has embraced a lifelong commitment to refining and fine-tuning the art and science of guiding individuals through the delicate realms of their own consciousness. And I believe that philosophy is very much aligned with nursing and nursing skills. As many of us know, nurses are typically very selfless in their dedication to their patients. And they take very seriously the role that they play in being entrusted with the health and life of each patient they encounter.
As many of us know, nurse coaching is somewhat a relatively new specialty that's gaining traction in the nursing world. Coaching is a natural extension of the nursing scope of practice to elevate the health and well-being of patients and communities. Listening with heart, which is healing, energy, awareness, resilience, and transformation, captures the dynamic elements of psychedelic facilitation. These are not systematic questions. They are, for the nurse coaches, a method to facilitate a safe environment within the context of the person being supported. Nurse coaches view the client as the expert of their own care, and that is definitely true when it comes to the use of psychedelics. When we speak of healing in this method, healing is the emergent process of the whole system bringing together oneself and the bio-psycho-spiritual, cultural environment aspects at deeper levels of inner knowing, thus leading it towards integration and balance, and with each aspect having equal importance and value. And you can find that listening with heart can be a beautiful method used during psychedelic care to support those who choose to use psychedelic substances. Nurses will always play a crucial role in ensuring client safety, both physically and psychologically, and especially during altered states, by assessing risk, implementing safety measures, providing emotional support, and advocating for a client's needs. They provide emotional support and reassurance to clients experiencing altered mental states, helping them feel safe and secure. And for those who work in med-surg and ICU, we work with a lot of patients that are in altered states, when they're heavily medicated. So they need to provide appropriate supervision and monitor to prevent harm, especially during periods of increased agitation or confusion. They should be prepared to intervene with appropriate strategies to de-escalate situations and prevent harm, while respecting the client's autonomy. And they also have this great skill of actively listening to the client's concerns and fears, validating their feelings, and promoting open communication. We've given a brief history of the importance of nurses in historical and present-day psychedelic care. As we become more aware of the need of nurses to have a voice in this evolving psychedelic space, my contribution was developing an introductory course for nurses who are curious about psychedelics and the individuals who choose to use them. What started as a capstone project for the Psychedelic Assisted Therapies and Research Certificate program that I graduated from has now come full circle with the partnership with the Integrated Nurse Coach Academy. It's a 4-module course that includes self-paced recordings, scientific articles, videos, online classroom discussions, and 4 Zoom fireside chats with Kayla and myself. I will teach the first 2 modules, the history of plant medicines, which, it has an overview of plant medicines and sacred traditions, the use of psychedelics, how it was introduced into the Western society, a bit about reciprocity and being a steward of plant medicine. The second module is the healing potential of expanded states. How do psychedelics work? We talk about the default mode network. We go over a couple of the clinical trials and then provide an overview of a lot of these substances like psilocybin, LSD, MDMA, iboga, ketamine, and DMT.
And then I'll be discussing the second 2 modules. So module 3 will discuss nurses and their holistic role in the psychedelic space, and that will include information about nurse theorists and healers of both the past and present. And module 4, which will encompass nurse coaching and the making of a psychedelic integration facilitator.
In the 1950s and 1960s, nurses were referred to by male physicians and researchers as attendants and sitters. But I think if you look into the hearts of those nurses in the past and current nursing practices, you'll find much more than the labels and the boxes that have been thrusted upon them. Nurses remain one of the most trusted professions, with 80% of the US adults currently believing nurses having high honesty and ethical standards. When working with individuals in altered states of consciousness, the foundation of trust is one of the most important traits you can offer. Our hopes are that through this introduction course, we can support you in taking that first step towards the journey of becoming a psychedelic-informed nurse, with hope that in the future you would take other steps that will be legally required to be part of a psychedelic multidisciplinary team, and that nurses will have a strong voice when it comes to contributing to shaping public opinion and supporting a future in which these treatments will be widely and safely accessible to all communities. We thank you, and you can find us on inurse.com. I'm going to stop sharing. And then I am back.
Thank you so much. So can you share any like powerful patient stories or outcomes that you've come across in your experience?
Well, it's interesting that that's the first question that's posed, because I mean, I can give you examples of what can occur or may have occurred, but I really can't go into actual like patient stories because, again, these substances are still not legal, only in the research models,
Okay.
except for ketamine, and we do know some experience of ketamine, but like in particular, is there like something that you would like to know about, or because that's such, yeah.
No, that's okay. Anything that you could share with us that from the research or anything that you've read.
Well, definitely, ketamine is interesting because, and then Kayla can kind of give you her insights on that as a provider. But ketamine can be given orally or it can be given IM, and those two are completely different. When speaking with my the therapists that are actually working with the ketamine. They like the fact that the IM, which is given by nurses, injections, I mean, it could probably be given by therapists if they're given out, but they're working with nurses who are given these IM injections, or also IV. IV can be titrated where it can kind of come, the experience can come a little slower and more, I think more, how would I say, with a patient, they're more willing to kind of like accept what's coming. I am, that can hit you in a minute or two, and then you're in a complete altered state of consciousness. And then the oral treatment is more like it kind of loosens those fears, and it's really good for talk therapy. It really kind of gives the person an opportunity to really discuss what's on their mind. So it kind of really loosens those restraints. But I'll let Kayla kind of take over on that.
Yeah. I mean, I think that was a really beautiful explanation, Deanna. But I would just add to it that ketamine really affects the neuroplasticity, right, in our brain. So that means our ability to form new neuronal connections in the brain. So it gives us this really open space to formulate new thoughts and opinions about ourselves and the world around us and sort of carry those with us. And that's why the therapy and the integration is so important with psychedelics in general.
Awesome. Thank
And
you.
I'll add that there's different windows for each one of the substances. Like for MDMA, we hear that it's like a 2-week window where that neuroplasticity is really like, I mean, you could do some really good therapy like in those 2 weeks. Ketamine is short acting. Kayla, correct me if I'm wrong, it's just a couple days, sometimes just 2 days. So I've heard of people who will have a ketamine IM injection, and then they'll plan like back-to-back therapy sessions with their therapist to really like work on something that's been on their mind that they want to heal. And yeah.
Okay. So, someone said, I've heard people go in with specific questions that they want to explore deeper. How does that work?
Yeah, I mean, I almost always get asked this question when I'm assessing people for ketamine appropriateness. And I always tell people it's okay to go in with specific questions, but it's also important to remain open to whatever other content might come up. So I might tell people to start journaling if they don't already, and then just kind of prepare them to be a little bit more fluid when the
Mhm.
session comes. Yeah.
Great. Thank you.
And what I would add to that is if people choose to go abroad and do it in a ceremonial kind of aspect, if they travel to Peru, if they travel to places where it's legal, um, the facilitator or the shaman will tell you you can go in with all the expectations and what you want to do, but the medicine's going to give you what you need, not what you're asking for. So, you know,
And someone did ask if it was possible to get a copy of the slides. So they're not prepared for like a release at this time, but I would like everybody to know that this presentation will be saved on Inca's website and Facebook. So you can go back and review at this time, anytime you want.
and they'll be incorporated into our either module 3 or 4 as well. They'll go into more detail. This was just kind of like something that we wanted to give you a taste of what probably would be more, in line with module 3 and 4.
Yes. And thank you so much for highlighting how the powerful role that nurses can play um, in this, new and exciting topic. May I know, is there a plant medicine course? Not within this one, but you said you do touch on that in your course, correct?
Correct. The entire first module is on plant medicines, and we provide a lot of scientific articles that have been written. And I try to provide you a scientific article on each one of the plant substances, along as we have also selected several videos that talks about plant medicine, and then of course the discussions. Our hope is that this course is a foundation, and we'd like to survey, the participants later when this course is over to say, well, we loved it, but we'd like a 4-module course on just plant medicines. So that's something that we'd love to hear feedback on from the community as well.
Lots of opportunities within the space in general. So
yes, so we encourage all the listeners to reach out to us for your needs and wants. To clarify, only ketamine is legal and only in a clinical setting in the US. I had a client ask me about LSD. I had no answer.
yeah, so for psychedelics, ketamine is the only current legal psychedelic here in the US. Unless you're doing like a research trial with MDMA or psilocybin, within the research context, it's also legal. So if people want to, they can seek out the trials, but they're pretty rigorous too. So
thank you. And someone wants to know, how can they enroll? So you can go to inursecoach.com and enroll right on that website. And there's also admission counselors that you can make an appointment with if you have any questions at all too. But if you want to ask them now, feel free. How do you foresee as a future for use of psychedelics?
That's a wonderful question. I mean, it's so wide open. Kayla and I, we had the opportunity of having a great mentor in our program because Kayla and I graduated from the same program. And if anyone wants to look him up, his name is Andrew Penn. And he is such a beautiful voice for nurses in this psychedelic space. You know, right now it's kind of wide open. It's what we want it to be. I mean, nurses, we have such a big voice in this. And I think we're being left behind. So it's really important that we all start becoming a more psychedelic integrated nurse, even if we just look at some YouTube videos or we look up some scientific articles. And if I think we were being left behind because they wanted a lot of this to be planned by therapists, you know, and clinical therapists on that level. And it's our job to kind of step into this voice. It's kind of like the nurse coaching, you know, when this whole coaching started, it was important that nurses have a voice to say, hey, nurse coaches are just as important as lifestyle coaches. And this whole program was developed around that same concept. In the same way, I think us nurses, we need to have that voice and say, hey, don't leave us behind on this because we've been doing this for a long time. And we won't be silenced. And if you don't want to give us a seat at the table, then maybe we need to build our own table.
I love that. Thank you.
well said. Yeah.
That's fabulous. How do you find info on the trials?
I mean, Google.
I think is it psychedelic researchtrials.com or researchtrials.com, and it'll take you to, and then you can put psychedelics and then all the trials that come up. And then also there's a couple of things out there either in Reddit or Facebook that if you look at, psychedelics or something like that, people will post that they're doing trials and they're looking for participants as well. But go ahead, Kayla. I'm sorry.
Yeah, I was just going to say, I know that Psychedelic Alpha is also a pretty good resource for information in psychedelic research in general.
Thank you. Do you see nurses being hired in ketamine clinics presently?
Yes. Yeah, I currently work at a ketamine clinic, and we hire RNs to give the IM injections and then also sit with patients during IM sessions as well as IV sessions. And then a lot of the therapists do the lozenges, but there's always an RN present.
And if you look like ketamine, like if you go to Indeed and you put psychedelic nurse or ketamine nurse, you'll see that they're looking for nurses that have like a really strong skills in IV, because a lot of the ketamines also are IV. So they're always looking for nurses with those strong skills as well.
Great. I am a registered nurse practicing in Singapore and now planning to migrate to Australia. May I know any courses available in Australia?
That's a great question. I actually, Deanna, correct me if I'm wrong, but I believe Australia was one of the first countries to legalize psychedelics. So you're moving to the right place if you're interested. Um,
Exactly.
I don't know if I know of any specific Australian courses, but there are tons of online
And you'll be able to
courses.
take this course.
Yeah.
You can take this course, but you can also look into Australia to see if there's certain courses or some kind of certification process that nurses are going to have to be signed off or licensed in Australia to work with psychedelic medicines. But definitely look at the Indeed, of Australia to see how that looks like.
And will the new course offer a path towards certification, or is there a path for national certification in this space?
Well, we mentioned that this is kind of like a 101 foundation course. And right now, there's a few certification programs. And again, this is while it's still in not really legal, except for in Oregon and Colorado, there's very few organizations that are certified. Like Kayla and I graduated from the program in San Francisco, and it was a 10-month program, and it's not inexpensive as well. It'll run you anywhere. The programs that I know, and if anyone's interested, there's an organization called Open Nurses, and you can see all the programs that they refer. And Open Nurses is also from our mentor and from our group, and they created it for nurses who are curious about psychedelics. But right now, this course is not in the process for certification. There's a really in-depth process to get certified. And most of them are through either universities or like long-term kind of research facilities that have been in this field for a while. Yeah.
Thank you. So not so much a question, but definitely backing you up that nurses must have a voice, that it's a huge issue right now, getting the therapist to believe that nurses are as good to be able to help the clients pre and post medicine journeys. So she or he is backing you up on what you said.
Great, thank you.
That's great. Well, thank you again, Diane and Kayla, for sharing all your knowledge and your experience and your passions with us tonight. Oh, I think we got some more. There's no there's no nursing certification in psychedelic nursing, as this is such a new field for us.
Mhm.
Um, oh, I saw the course is March 31st to May. Yep. How is this timing like? Is if joining from overseas? Okay, gotcha. So you can reach out to us and we'll figure out the time difference. The fireside chats that will be live that Diana and Kayla were mentioning will be also recorded so we can work with you. So please reach out to us because we'll figure out a way. And I think that concludes. Oh, someone just said, thank you, Diana and Kayla. Interesting talk about such a new topic. Yes, it is so interesting. And I just feel like this is such a transformative time in nursing. And it's just so inspiring to see the many pathways we can take to support healing in such bold and innovative ways. So thank you both. And I encourage everyone to continue exploring what's calling you on your nursing and nurse coach journey, whether it's the psychedelic care, community healing, or something else. So thank you everybody for joining us. And be sure to follow us on social media so you can stay up to date on all the new offerings. And until next time, take care. Thank you all so much. Good night.